Welcome back to OMFS Essentials. In Part 1, we explored the complex and dangerous anatomy surrounding the mandibular third molar. We now build on that foundation to understand how we describe and categorize these impactions. Classification is essential for clear communication, for assessing the degree of surgical difficulty, and for predicting the proximity to vital structures we discussed in Part 1. Today we cover the primary systems: Winter's classification, Pell and Gregory's classification, and Winter's war lines. 1. Winter's classification, angulation. This is the most common classification, and it describes the angulation of the long axis of the impacted third molar relative to the long axis of the second molar. Mesioangular. The third molar is tilted towards the second molar. This is the most common type of impaction. Distoangular. The third molar is tilted away from the second molar, distally. Vertical. The third molar is in a normal vertical position but is trapped. Horizontal. The third molar is lying on its side at a 90-degree angle. Other, less common types include Buccoversion, tilted towards the cheek, Linguoversion, tilted towards the tongue, and inverted, upside down. 2. Pell and Gregory's classification, depth. This system classifies the impaction in two different ways. The first is position A, B, and C, which describes the relative depth of the impacted third molar. Position A is the highest portion of the impacted third molar is at or above the occlusal level of the second molar. Position B is the highest portion of the third molar is between the occlusal level and the cervical line, or neck, of the second molar. Position C is the highest portion of the third molar is below the cervical line. As you can imagine, a position C impaction is the deepest, most difficult, and has the highest risk of being near the inferior alveolar nerve. 3. Pell and Gregory's classification, space. The second part of the Pell and Gregory system is class 1, 2, and 3. This describes the amount of space available between the distal surface of the second molar and the anterior border of the ramus. Class 1, there is sufficient space to accommodate the entire crown of the third molar. Class 2, the space is inadequate. The third molar is partly in the ramus. Class 3, there is no space. The third molar is totally impacted within the ramus. A Class 3 impaction will require significant bone removal from the ramus for access. 4. Winter's war lines, radiographic assessment. This is a quick radiographic assessment tool to determine the difficulty of elevation. It involves drawing 3 imaginary lines on a radiograph. W, white line, an imaginary line drawn over the occlusal cusps of the erupted first and second molars, extending posteriorly over the third molar. It indicates the occlusal plane. A, amber line, an imaginary line drawn along the crest of the interdental bone septum between the molars. It indicates the bone level. R, red line, an imaginary line drawn perpendicular from the amber line to the imaginary point of elevation application on the third molar. The length of this red line indicates the amount of bone that must be removed before the tooth can be elevated. A longer red line means a more difficult, deeper impaction. Summary. These classification systems provide a complete surgical picture and a universal language. A surgeon can now describe a complex case in a few words. We have a mesioangular, position B, class 2 impaction. This simple phrase instantly communicates to another surgeon: 1. Mesioangular, the tooth's angulation. 2. Position B, its depth relative to the second molar. 3. Class 2, the fact that it is partly covered by the ramus. This concise description immediately frames the surgical difficulty, the expected amount of bone removal, and the potential risks involved. You've been listening to OMFS Essentials. As always, keep mastering the essentials.